Right now, before you do anything else, I want you to hold up one of your hands and look at it carefully. Not a quick glance, a real look, because in the next few minutes, I am going to show you something that most people over 60 have never been told. Something that cardiologists use every single day, but rarely explain to their patients. Your fingernails are quietly recording what your heart and your blood vessels are doing. They have been doing it your entire life. And if you know exactly what to look for, they can warn you about a cardiovascular crisis before it ever happens. I am Dr. Mandel, and I have dedicated most of my career to preventative cardiovascular care for adults over 60. Over the years, I have seen something again and again in my clinic that genuinely bothers me. People come in after a heart attack or a stroke, and when I examine them closely, the warning signs were already there on their nails. Sometimes for months or even years before the event, nobody had noticed. Nobody had told them what to look for. That ends today. Stay with me until the very end, because the last sign I cover is the one most people are completely shocked by. Before we go any further, I want you to do something in the comments right now. Type your age and tell me whether anyone in your family has ever had a heart attack or a stroke. Your answer is going to determine how urgently you need to take everything we are about to cover. And if this kind of content is helpful to you, please hit the like button, because it genuinely helps me reach more people who need this information. To understand why your nails carry this information, you need to understand a little bit of biology. Your nails grow from a structure called the nail matrix, which sits just beneath the base of each nail. Those cells in the matrix are in direct, constant contact with your bloodstream. They are nourished by the tiniest blood vessels in your entire body, the capillaries that run beneath your nail bed. And because those vessels are so incredibly small, they are among the very first structures to show stress when your cardiovascular system starts to struggle. Think of your nails as a live monitor that your body has been running quietly every single day. After 60, the reason this matters even more is that the body's ability to compensate for early cardiovascular problems gets much narrower. In your 30s, your heart can quietly work around dysfunction for years, and nothing visible happens. But after 60, those reserves are thinner. The warning signals start to appear earlier, and your nails are often where they appear first. The problem is that a typical 15-minute doctor's appointment cannot cover everything, and nail examination rarely makes the priority list unless something is visually alarming. So, the information exists in medical research. It just never makes it to the person sitting at home who actually needs it. That gap is exactly what I want to close for you today. The first sign I want to walk you through is called Terry's nails. This is not a term most people have ever heard, but once you know it, you will look at every pair of hands differently. Terry's nails happen when the entire surface of the nail turns an opaque whitish or very pale color, almost like frosted glass, with one key feature at the very tip. There is a narrow strip of pink or reddish color at the far edge of the nail, usually just a few millimeters wide. That strip at the tip is the defining marker that separates Terry's nails from ordinary pale nails. Now, here is why this matters for your heart. Research published in Cardiovascular Medicine has identified Terry's nails as significantly associated with coronary artery disease, heart failure, and diabetes. One study found that people with Terry's nails had an odds ratio of over 6 for coronary artery disease compared to people without them. That is not a minor statistical footnote. It is a major signal. And all of the conditions linked to Terry's nails share one thing in common. They develop slowly and silently over years before anything dramatic happens. A patient I will call George came in to see me when he was 71. He had no dramatic complaints. He felt reasonably well, but had been a little more tired than usual, which he naturally blamed on age. During the exam, I noticed his nails looked unusually pale, with that characteristic reddish strip at the tip. I asked him some careful questions, ordered an echocardiogram, and the result revealed early-stage heart failure that had been developing for close to 2 years without any obvious symptoms. George is doing very well today. He got the right treatment at the right time. His nails were the doorway that opened that conversation. The second sign is called Lindsay's nails, and this one has a very particular appearance that you will recognize immediately once you know what it is. Lindsay's nails are sometimes called half and half nails because the nail is divided into 2 distinct zones. The half closest to your cuticle is white or very pale, and the half closest to the tip is a brownish-red color. The dividing line between the 2 zones is usually quite sharp and clear. Lindsay's nails have been associated in clinical research with heart failure and with liver cirrhosis, and they tend to appear after the body has been under sustained circulatory stress for some time. The reason I include both Terry's nails and Lindsay's nails early in this conversation is that they are both disorders of nail bed color that reflect how well blood is actually reaching and nourishing the smallest tissues in your body. When circulation to the fingertips is compromised over a sustained period, the nail bed loses its normal pinkish color and begins showing these altered patterns instead. Both signs are visible in ordinary daylight without any special equipment. If you hold your hand under good natural light right now and look carefully at each nail, you can check for both of these signs in less than 30 seconds. Do it now while the descriptions are fresh in your mind. The third sign is something called Mises lines. These are multiple horizontal white lines that run across the nail parallel to the lunula, which is the small crescent shape at the base of your nail. Mises lines do not feel raised when you run your finger over them. You can see them clearly, but you cannot feel them with your fingertip. This is one detail that helps distinguish them from other types of nail ridges. They are a visual signal, not a textural one. What makes Mises lines particularly significant is the research behind them. A study examining the relationship between nail findings and cardiovascular disease found that Mises lines were a statistically significant predictor of heart failure with an odds ratio approaching 6. That means the presence of these lines in a patient made heart failure substantially more likely. The underlying reason is that Mises lines reflect low albumin levels in the blood, a marker of the body being under prolonged nutritional and circulatory stress. When the heart is struggling to circulate blood efficiently, the rest of the body starts to feel it. A patient named Margaret came to see me at 68. She was active. She was not overweight, and she genuinely felt fine. During the visit, she mentioned, almost as an aside, that she had noticed some horizontal lines on her nails over the past few months. She figured it was probably nothing. I looked carefully and recognized Mirka's lines across several fingers. I ordered a cardiovascular workup and found early heart failure that was entirely manageable at that stage. The lines had been appearing for months. They were her body's way of asking for help. The fourth sign is called Bow's lines, and this one tells a very different story from the others. Where most nail signs build up gradually and reflect chronic conditions, Bow's lines appear after a specific event. They are horizontal grooves or depressions that run across the nail plate. They appear because when the body undergoes a significant physiological shock, whether a heart attack, cardiac surgery, a severe infection, or any other major health crisis, the nail matrix briefly stops producing new nail tissue. When growth resumes, the pause leaves a groove behind in the nail. What makes Bow's lines clinically important is that they can reveal a past cardiac event that the patient themselves may not have recognized. Silent heart attacks are more common than most people realize, particularly in older adults. A patient named Harold came in to see me for something entirely unrelated. I noticed a clear horizontal groove across nearly all of his fingernails. I asked him about it, and after some thought, he recalled being very seriously ill about 4 months earlier, with what he had assumed was an unusually bad flu. We ran some tests and discovered he had experienced a silent heart attack during that illness. His Bow's lines told the story his symptoms had not. Now, I want to shift to something you can check directly underneath the nail surface rather than on top of it. These are called splinter hemorrhages. They look exactly as the name suggests, like tiny dark splinters or thin dark lines running vertically beneath the nail. They are actually small collections of blood trapped in the nail bed capillaries. And while a single splinter hemorrhage from bumping your hand against something is nothing to worry about, multiple unexplained splinter hemorrhages across several fingers is a different matter entirely. Classically in medical training, unexplained splinter hemorrhages across multiple nails are associated with infective endocarditis, which is an infection of the inner lining of the heart's chambers and valves. This condition develops when bacteria enter the bloodstream and attach to damaged heart tissue. The infection causes tiny clots to break off and travel to distant blood vessels, including the tiny ones in your nail bed. Infective endocarditis is a serious condition that requires urgent medical attention. A patient named Phyllis noticed these dark lines on several nails and mentioned them to me almost as an afterthought. She was diagnosed with a heart valve infection that was caught in time to treat effectively. She told me later that she almost did not mention it at all because she thought it was nothing. If this video has been useful so far, I want you to do one thing right now before we continue. Hit the like button. It takes 1 second, and it genuinely makes a difference in whether this content reaches others who need it. And stay with me because the next 2 signs are the ones I want you to take the most seriously. The small whitish crescent at the base of each nail is called the lunula. Most people think of it as just a cosmetic feature. It is actually the visible portion of your nail matrix, the active zone where new nail cells are being formed around the clock. And the color of your lunula is one of the most overlooked diagnostic signals on the entire body. When that color changes, it is worth paying attention. Research has found that a reddish lunula is significantly associated with valvular heart disease and with congestive heart failure. A bluish or purplish lunula suggests problems with oxygen delivery in the circulation, similar to the cyanosis we see in more advanced cardiovascular disease. A lunula that has faded to almost nothing or become very pale is often a sign of anemia, and anemia is directly connected to cardiovascular strain because an anemic heart has to work significantly harder to compensate for the reduced oxygen carrying capacity in the blood. All 3 of these color changes deserve medical attention. I want to tell you about a patient named Dorothy, who was 74 years old and called me after her daughter, who happened to be a nurse, noticed during a visit that the half-moon shapes on Dorothy's nails had almost entirely disappeared. Dorothy had not noticed a change because it had been happening so slowly. She had been looking at those nails every day and simply adjusted to the new normal without realizing anything had shifted. Her daughter encouraged her to bring it up at her next appointment. We did a complete blood count and a cardiovascular workup. She was significantly anemic and was showing early cardiovascular strain. Both issues were caught and treated before anything serious developed. Now, let me teach you a test you can perform on yourself right now using nothing but your hands. It is called the capillary refill test, and it directly measures how quickly your smallest blood vessels recover from pressure. Here is how you do it. Hold your hand at the level of your heart. Use the thumb of your opposite hand to press firmly on one of your fingernails for about 2 seconds. You will see the nail bed go pale or white as the blood is pushed out. Then release the pressure and start counting quietly in your head. In a healthy adult with good circulation, the pink color returns to the nail bed in under 2 seconds. If it takes 3 seconds or longer, and you get the same slow result when you test 3 or 4 different fingers, that is a meaningful sign that your microvascular circulation is sluggish. Research has linked persistent slow capillary refill in older adults to reduced cardiac output, undiagnosed atrial fibrillation, and elevated stroke risk. Try this test right now before you finish this video. Do it in a warm room with warm hands so that cold temperature does not distort the result. A patient named Walter tried one evening after hearing about it and counted nearly 5 seconds before the color came back on his index finger. He tested his thumb next, then his middle finger, and then the fingers on his other hand. He got the same slow result every single time. He called my office the following morning and described exactly what he had observed. A full workup revealed undiagnosed atrial fibrillation, which is one of the most common and dangerous causes of stroke in adults over 60. He was placed on appropriate treatment, and according to everything we know from current cardiology literature, that call very likely prevented a major stroke within the following year. Walter had absolutely no other symptoms at the time. Now let me give you a practical framework for what to do with all of this. I want you to start today, not next week, not at your next appointment. Take both hands to a window in good natural daylight. Look at each nail one at a time. Check the color of the nail bed for any bluish, purplish, or unusual pallor. Look at the tip of each nail for that characteristic reddish band that signals Terry's nails. Look for horizontal white lines across the nail that you can see but not feel. Check for any deep horizontal grooves that might be Bow's lines. Look for tiny dark lines beneath the nail surface that appear without any trauma. Examine the base of each nail for the lunula and notice its color and size. Then do the capillary refill test on at least 3 fingers and count the seconds honestly. Write down what you find. This step matters more than most people realize because these changes are slow and gradual, and human memory is notoriously unreliable over months and years. A photograph of your hands taken today in natural light gives you something concrete and honest to compare against 6 months from now. If you see one of these signs, mention it at your next routine appointment. If you see 2 or more of these signs together, do not wait for your annual checkup. Call your doctor's office this week. Describe what you observed and ask whether you need to be evaluated sooner. One more thing before I close. Please do not use any of this to diagnose yourself. What these signs do is give you a reason to have a specific and informed conversation with your doctor. The full clinical picture, your history, your medications, your other symptoms, is what produces an accurate diagnosis. Your job is not to diagnose. Your job is to notice, to document, and to speak up. That is the part most people never do, and it is the part that makes all the difference. Your nails have been sitting at the end of your fingers your entire life. They have been taking notes every single day about how your blood is moving, how your heart is working, and what your smallest blood vessels are doing. The only thing that was missing was someone telling you how to read what they were recording. You now have that. Use it. Share this video with someone you love, because the next person who watches this might be the person who spots something on their own hands tonight and makes a call that saves their life. I will see you in the next video.